I'm Dr. Charles Lawrie. I'm an orthopedic hip and knee replacement surgeon in Miami, Florida, and the current president of the Anterior Hip Foundation. So I was lucky to be in training when the anterior approach was really hitting its inflection point in terms of popularity. It was still considered a newer technique in the US when I was in residency and fellowship. And I recognized it as an innovative procedure with the promise of making patients better, faster, and improving accuracy and precision of the surgeries we do. It's been really exciting to see the growth of the anterior approach over the past 5 to 10 years. Where 10 years ago, it was a minority of surgeons doing anterior approach as their primary approach for hip replacement. So we're really seeing growth and refinement in the surgical technique. And that's led to, I think, more widespread adoption as people recognize the benefits that it provides both to the patients and to the surgeons and the team. So there's great evidence that the anterior approach provides a much more pleasant experience for patients in the early recovery period. So during the first 6 weeks after the surgery, patients, evidence-based, will take less opioid medications, they'll limp less, they'll get off their walkers and canes quicker than any of the other approaches out there for hip replacement. And then from a surgeon standpoint, there's definitely less surgeon physical effort and surgical team physical effort performing the procedure, which, as a young surgeon, I value that because I'm hoping to do this for many, many years. So I've been lucky enough to be invited to do quite a bit of teaching for the large orthopedic companies, predominantly implant manufacturers. And through those experiences, I got to know the team from Mizuho fairly well. And when the team from Mizuho approached me and said they were potentially interested in hosting their own labs, I got really excited because the Hana table truly is a phenomenal product for performing direct anterior approach hip replacement. It's so seamless to use it that we almost forget that we're using it. So when they told me they wanted to bring it to the forefront and teach labs centered around the Hana table, I thought it was a phenomenal idea. And they wanted to take it to the next level and do that on an international basis, which was even more exciting for me. I live in Miami, which is a big multicultural city. They call it the capital of Latin America. So we started with a lab here in Miami focusing on surgeons from all over Latin America, which was just a truly phenomenal and interesting experience to have surgeons from all different cultures and backgrounds, converge on Miami just to learn about anterior approach hip replacement and just to learn about it on the Hana table. It was a really rewarding experience learning from them, what's common in their countries, what the barriers are to adoption of anterior approach in their countries, and how I could potentially help them break through some of their struggles they had learning and performing the approach. And then, recently we took the course on the road to Bern, Switzerland for a European International Anterior Approach Hip course with Mizuho, again, focusing on the Hana table as well as the benefits of anterior approach and surgical technique. And again, just completely different experience, different surgeons, different cultures, different backgrounds, but again, equally as rewarding because again, we're just taking people from all different walks of life, different types of training, and taking them all and teaching them what I think is the best way to do a hip replacement and seeing them leave the lab, go home, and then try those procedures and do those procedures on patients and message me about the incredible outcomes they're having. It's just been an awesome thing to see and be a part of expanding the approach and the Hana table knowledge worldwide. I've done anterior approach essentially every possible way that you can at this point. I learned in the lateral position on a split pegboard. I've done it on a regular OR table. I've done it on various traction tables. And then finally on the Hana table. And all the ways that I progressed through doing the anterior approach on different tables, different positions, I've really found that doing it on the Hana table provided the best patient experience and the best surgeon experience, allowing me to really perform a very reproducible procedure the same way every time with really very limited effort physically from myself and my assistants, because the table is really doing a lot of work for us. So again, the Hana table for me has been a game changer in terms of my technique, and really helped accelerate my patient outcomes. The team from Mizuho is 100% dedicated to teaching the anterior approach to surgeons who are interested in learning. The courses that have happened so far have truly been, world-class in terms of the locations, the organization, the teams, the faculty to attendee ratio. So I would just encourage anyone interested in either learning anterior approach or taking their current skills to the next level, really look into these courses that Mizuho is offering, because again, I truly think that they're just second to none. If you want to learn more about the Direct Anterior Approach, please follow the Anterior Hip Foundation. We're a wonderful organization that provides education to surgeons worldwide. You can find us at www.anteriorhipfoundation.com, or follow us on Instagram or LinkedIn for the latest updates. And don't forget to check out our annual meeting happening in Nashville, Tennessee.